Okay, so this is the MRI sentinel table. The patient will have a lock or a needle put in the arm in the prep room and be coached and screened properly before they come in. And that process takes about 10 or 15 minutes. It's very important that the patient is well coached on the motion factor and exactly what's going to happen so there's no surprises. The patient will be climbed onto the table using the step stool and will put on prone or face down onto the table. The patient's breast will lie within the section here, and this is actually the breast coil. This panel right here is actually the breast coil. Now, once the patient is positioned, we prefer the patient positioned with the arms back to give the best visualization of the breast. This panel can move up and down to make sure that you get all the breast tissue underneath the axilla, and also anterior and posterior. You move the patient back and forth to make sure that you're not missing any breast tissue anteriorly. And there's also mirrors down at the bottom to make sure that the breasts are profiled and as symmetrical as it can be. The patient then is place their head here. This will move up and down for patient comfort. And usually the patient is face down, but if they want to be a little bit face up, they can be as well, depending on their comfort level. Again, we instruct the patient on motion, and you get them as comfortable as they can. All of these sponges here are positionable, and you can remove them, add them, because every patient's body is different. It depends on their body habits and how they feel in there. So once they are positioned, this table will move into the scan. The patient's body part has to be exactly in the middle of the gantry. That's what we call isocenter. That's where the magnet is the strongest. That's where we're going to get our best images. So the patient will be moved in. We will have an automatic pump injector that will introduce the dye. And the images will be taken dynamically, like at timed intervals, as the dye is going in and coming out. It's called a washed in, washed out effect, and that gives the radiologist some more information. The whole exam will take about 30 to 40 minutes. We as technologists are behind the window. We keep in contact with the patient all the time in between series, making sure they're right, remind them not to move, letting them know what's going to happen. The patient is also given a pen and ball that they hold in their arms. In their hand, down here like this. If they need us urgently, they squeeze the ball so that they can always be in contact with us. This is a very, very noisy exam, so the patient is always given earplugs as well to protect their hearing.
And what are the images used for that are taken?
Okay, the images are viewed by the radiologist. We take two-dimensional and also three-dimensional images. They are reformatted to give all three planes, axial, sagittal, and coronal view of the breast. They then are interpreted for pathology and for content. And like I said, the washed in, washed out images, well, depending how the pathology picks up the dye and releases the dye, will also give more information to the radiologist.